Hello, Alberta. This is David White. It's been a long while since I've been able to spend time with you, and I have missed spending time with you, I assure you. For the last few months, I've actually been serving as a paramedic front lines in the industrial sector amongst and supporting several hundred men and women in a semi-isolated location where signal has been significantly challenging. So the ability to communicate and share with you as much as I would have liked has been obviously diminished. That being said, now that I'm back out in civilization, I wish that we were in better circumstances, but we're not, obviously. We have a brand new bouncing baby disease to try and deal with, that being COVID 19. And as I've spoken with other healthcare professionals and we share information amongst one another, as well as taking in the information from the CDCs throughout the world, we only shake our heads. We are bewildered by the vast overreaction that seems to be taking place. For China, we can understand it. For Italy, there's some anomalies that are taking place, but it does not seem to be applying to Canada, nor should it. This particular disease, and I'm not diminishing it, it will kill you. It will absolutely go after you and kill you if you're in what seems to be two specific segments of our population. One, if you are the elderly, and two, if your immune system is compromised or if you have other health issues that are compromising your health, in which case it will take advantage of that and it will go after you with intent. For the rest of us, we're going to be exposed. If you're exposed, you're going to feel like crap for a couple of weeks, much the same as any other cold flu type illness. You will weather it, you will recover. And that is what we're talking about. We're talking about the likes, actually. I did some crunching of numbers and comparing the COVID-19 to H1N1, SARS, MERS, and our seasonal flu. Here's some of the things that I've found. One, for H1N1, we had 10,156 people that were infected with 428 deaths with a kill rate of 4%. That was for H1N1, and that was in Canada. For SARS, we had 438 cases with 44 deaths for a kill rate of approximately 10%. For MERS, which to my understanding we're thankfully not exposed to here in Canada, but it had 2,494 cases with 858 deaths for a 34% kill rate. Our seasonal flu, currently this year alone, we have 49,501 cases with 85 deaths. The kill rate on that is approximately 0.1%. Now, for COVID-19, this is a bit of a nastier bug. There's no question. And again, it's targeting our elderly and those who are compromised with their immune systems. And currently we have 772 cases out of 34 million people. Keep that in mind. 772 cases with 9 deaths for approximately a 1% kill ratio or kill rate. This is not the be-all and end-all apocalypse. This is not the type of thing that we should be reacting to the degree that we are reacting. If we wanted to consider this a fire drill, excellent run, excellent test of our systems, and there are lessons to be learned, but we missed critical middle steps. First off, when this first came out, the federal government should have deployed a rapid response team to all of our ports of entry. We did it with SARS. Where were they this time around? Well, they had highly trained, qualified professional medical personnel screening each and every person that came in from the hot zone. And then, of course, if you want, and if you're that concerned, have appropriate isolated transportation to take these individuals to self-quarantine for the 2-week period. That makes sense. The other things that were missed, well, let's cover some of the things that were hit first and done well. First off, wash your hands is the advisory. We've been hearing that for well over 20 years, applies to cold and flu, and it definitely applies to this. It's one of the main modes of transportation for this particular bug, as well as many other viruses. So absolutely makes perfect sense. Sneeze control. Make sure that you sneeze into your arm, into your jackets. Limit the spray that you spew out all over the place. That makes perfect sense. And again, we've been getting that for at least 20 plus years. And again, it applies to cold and flu. No news there. It's appropriate. It's the right thing to do. If you're feeling sick, don't go to work. We've been getting that news for at least half a century now. Many people have been ignoring it. Employers, if you have somebody that's coming in sick, you turn them around, you send them home with pay if required, but they go home. That's something that we need to bone up on. But it's not anything new because we've had it for cold, flu, as well as these other diseases that we've been confronted with, and it applies to COVID-19. Areas, however, that we skipped in getting to this area or this place now where we are so phobic about one another that we can't actually be around each other for fear of breathing the air. First off, decentralization. This disease goes after our elderly and those who are immune compromised. The advisory to not go to the hospital unless it's dire is absolutely appropriate. We need to protect the people in that hospital who are already in danger or who are already weakened in their own states of health. So we needed to set up a decentralized receiving facility for testing and, if required, treatment. So it's separate. It's not like we can't do that. There are many opportunities and locations that can be set up. Indeed, with the current limitations, we have a coliseum here in Edmonton that isn't being used for anything. Huge open space, completely viable, completely appropriate. And there are many other places that municipalities can set aside that would utilize, and I mean, certainly taking a look at their emergency response plans for if their hospitals were compromised, they would already have locations that would be appropriate to turn to. Gatekeeping our hospitals. Again, protecting the people already in there with already compromised health conditions. They need to be protected from this bug. That makes sense. So before you even make it through the door, having a person acting as a gatekeeper, and if you have cold, flu, or COVID-19 type symptoms, you don't even make it through the door. You're going down a side passageway, be it a tent or covering of some type, into a tent or into the decentralized location for testing and for treatment if required. And initial assessments don't even have to have direct person-to-person contact. They've set it up in many locations whereby you're utilizing telehealth and you're able to do your assessments that way. Get your questions done. And kudos to the government for setting up 811, and kudos for the government for making sure that you have the advisories to not go to the hospital, to stay home if you're feeling ill. All those are perfect, absolute. And the self-assessment checklist online, absolute brilliance. Nothing but A+ to our premier and to our health minister for doing that. Well done. But we missed the middle steps before we went to the extent of, you can't come anywhere near me. I won't say where the store was, but it was a large store where they had 40 workers inside and a lineup of 20 to 30 people standing outside in -17 in the shade with wind, no covering, no protection, being compromised for over half an hour. You want to get sick, that's a good way to do it, because they were only allowing 10 people into the store. And we're not talking a small, tiny space. We're talking a huge open air facility. It's just a level of insanity that I'm bewildered by. It doesn't make sense. It's overreaction. And I've been hearing stories about people getting into or almost on the verge of literal fistfights over packages of hamburger. Of course, we've all heard about the shelves being completely cleared out of our staple goods, be it food or toiletries. And Alberta, we need to take a breath. We really do. The number of people that are compromised with this particular disease is extremely small. And I understand that we're trying to keep it that way. I also understand that we're trying to make sure that the peak that we have for our intensive care unit admissions, we want to flatten that out so that we're not overwhelmed. That makes sense to me as well. But the complete population of Alberta and Canada is not going to be exposed to that. And a 1% hit with that population is not going to take place. By following these basic steps plus these middle steps, these safeguards, that would have been more than sufficient. Not taking on the economic and the social tolls that are already taking place. We can't change anything about it right now. This is where we're at. If you wanted this as a test zone or a drill, excellent drill. Again, lessons that are supposed to be learned and should be applied, some of which I've already mentioned. For the time being, Alberta, take a good breath. The air is good. It is safe around us. This is not the apocalypse incarnate. This is not end of days. Go get the food that you need. There's no need to hoard. You don't have to arm yourselves. You don't have to prepare for the hordes coming through to take everything and for a complete disassembling of order and governance. That's not the case here and now. We are safe. For the most part, we are safe. Take the appropriate precautions. If you're feeling ill, stay at home. If it's truly serious, call 911. By all means, utilize the online screening system, and by all means, if required, use the 811 system. I'm sure that we'll be having more conversations about our healthcare system and the need for having our doctors and nurses at maximum numbers in future days, but this is not the time to have that conversation. Generally speaking, there's no need to fight amongst ourselves or our neighbors. We are going to be fine. There are more supplies coming. There is more food coming. All you need to do is live your life normally as far as your everyday requirements are concerned. And we will make it. You will make it. I have faith. More to be shared soon. Take care, Alberta. You're in my thoughts. Bye for now.